because addiction is a systemic disorder. What we mean by that is that the system helps create the disorder. It's not just the individual. Sure, the individual has a response that becomes an addiction, a compulsion that becomes an addiction, but the system is still there keeping everything going. And that's why relationships are so important. So we need to ask ourselves, why do we compulsively turn to this object, this significant object that we've chosen, heroin, cocaine, alcohol? What is going on in the other relationships? In my marriage, with my children, with my parents, boyfriend, girlfriend, at work, my colleagues, my friends, what is going on in those relationships? So it's quite important that we do a little bit of an inventory, and we try and note the quality and the nature of our most significant relationships. The quality, what is the quality of the relationship? Is it an intimate relationship? Can we be vulnerable with each other? Can we be honest? Can we be clear? Are there passive-aggressive overtones? Do we not speak clearly with each other? Are there mixed messages? Or is it open? Is it transparent? Is it safe? Is it trusting? Is it reliable? Quality. The nature of a relationship is this relationship ordered? Are you really my father in this scenario, or do you treat me like a buddy? Are you really my son, or are you talking to me like a parent? We need to make sure that relationships are ordered. If I have a relationship with a spouse, do they talk to me like a parent, or do they talk to me like an adult? This is what I mean. So we look at this, and I invite you to go through each of these and notice out of 5 the quality. Give it a mark. Literally go through all the people that are close to you. Give it a mark out of 5, 1 to 5, and just have a look, step back and have a look at it afterwards. What is the quality of those relationships and the nature? Is it ordered, or my spouse keeps on treating me like a child, so I feel like the child in the relationship? Go through the list and do a bit of homework if you don't mind. It's very eye-opening, because we get so blindsided by addiction. We get so focused, and there's another video on that with the myths of addiction. We get so focused on the object, which is just a symptom really. If I keep on displacing my energy onto a target like booze, that's a symptom. That's a red flag. That tells me that something else is wrong in the system. And we are so obsessed with that, and have been in the past with addiction clinical medicine, that we're so fixated on the object. Just say no, just try and control your cravings. We need to look at the system that is encouraging this displacement. Sometimes we also need to note the absence of relational possibilities or benefits or needs. So if I go through that list, what was missing? Did I have an absent father, an absent mother? Do I have an absent spouse? It's very important to also see what I'm not getting from those relationships. For example, what do I expect from a marital relationship? Trust, support, comfort, nurturance. Am I getting those things, or is there an absence thereof? Be quite critical of your relationships. It will really help you understand the system that you're in. Because the solution to addiction is the connections. It's not just saying no.